During the last quarter of 2019, when the initial news regarding the flu in Wuhan came out, people from the Philippines are oblivious about what it really is. As days go by, news of its spread is making headlines. But almost everyone was downplaying the virus. Many thought, Huanan Seafood Wholesale Market in Wuhan, China is far from their place. Many thought, it's just a flu, a simple flu at that. On December 31, 2019, Chinese authorities alerted the World Health Organization of pneumonia cases in Wuhan City, Hubei Province, China with an unknown cause. What started as a mystery disease was first referred to as 2019 nCoV and then named COVID-19. January 2020 came. Officials closed the Huanan Seafood Market, suspected to be the source of the mystery disease, as some of the patients presenting with the pneumonia-like illness were dealers or vendors at the market. By January 7, China identifies new coronavirus as cause of the outbreak. Coronaviruses are a large family of viruses that can cause varying levels of disease, from common colds to severe fatal diseases. Usually found in animals, some can infect humans and transmit between humans. Both SARS and MERS are caused by a coronavirus. From then forth, there was a steady increase in the number of infected patients in China. Other countries are also reporting their initial cases of infection, like South Korea, Thailand, Japan, and Vietnam. By January 21, World Health Organization confirms human-to-human transmission of the virus. The total number of cases reached 222, which also includes infections among healthcare workers. WHO Director General Tedros Adhanom Ghebreyesus has convened an emergency committee on January 22 to decide whether this constitutes a public health emergency of international concern. However, as per recommendations by the emergency committee, WHO's Director General decides to not declare the 2019 nCoV outbreak a public health emergency of international concern yet. As January progresses, Canada, Australia, United States of America as well as Europe are reporting confirmed cases of COVID-19. By January 30, WHO Director General Tedros Adhanom Ghebreyesus declares the 2019 nCoV outbreak a public health emergency of international concern, noting the potential spread of the virus to countries with weak health systems. The decision came as more countries outside China report cases of infection, including the Middle East, United Arab Emirates, Philippines, and India. The announcement came just a week after Tedros initially refrained from declaring the outbreak an emergency. Come February 2, the first 2019 nCoV death outside China is reported in the Philippines. The patient was a 44-year-old Chinese male, a known companion of the 38-year-old woman who tested positive for 2019 nCoV on January 30 and the first case in the Philippines. It also imposes travel ban for travelers coming from China, Hong Kong, and Macau, and a 14-day quarantine period for Philippine residents. And the most feared first local transmission of COVID-19 was confirmed on March 7, 2020. The Philippine government mounted a multi-sectoral response to the COVID-19, through the Interagency Task Force on Emerging Infectious Diseases chaired by the Department of Health. Through the National Action Plan on COVID-19, the government aims to contain the spread of COVID-19 and mitigate its socioeconomic impacts. As everyone tried to contain the panic and fear in the community, various agencies worked 24/7 to lessen the impact of the virus. The government then imposed community quarantines and lockdowns in various cities and provinces to deter the spread of the virus. As Metro Manila braces the virus, the people in Mindanao kept ardent prayers to keep the virus at bay. Land, domestic air and domestic sea travel to and from Metro Manila was suspended by March 15. President Rodrigo Duterte declared a state of calamity in the country for 6 months due to COVID-19 through Proclamation No. 929 on March 16. With this development, hospitals in the region started conducting training for healthcare providers. Emerging and Re-emerging Infectious Disease or ERID team was formed. Rapid Sequence Intubation team was also organized. Every day, COVID-19 updates are posted. The number of cases as well as death continuously increased. The virus halted the global transportation and economy, affected famous and world-renowned individuals, locked down towns and cities, and made individuals stay at home for safety. As people are forced to stay in the confines of their homes with their family, the so-called frontliners had no other choice but to bravely face the unseen threat. Aside from the healthcare workers, other hospital personnel, the military personnel, social service workers and food delivery crew also went out and raised the threat of COVID-19. March 10, the first confirmed COVID-positive case was reported in the region. And every day, the number of confirmed cases is increasing. Despite this, there are also numbers of recoveries. Southern Philippines Medical Center in Davao City and Davao Regional Medical Center in Tagum City became the COVID-19 facilities in the region, with the support of the private hospitals. Interagency meetings headed by the regional director with the provincial and city health offices were done with the participation of private hospitals as to the flow of referrals to make the handling of cases systematic. Trainings on the donning and doffing of the personal protective equipment for health workers was done in different hospitals in the region. So as not to exhaust the manpower of the ERID teams, all personnel in the government and private hospitals in the region were also trained. Training on proning of patients in the mechanical ventilator support system was also conducted. Southern Philippines Medical Center in Davao City have a total of 70 respiratory therapists. They have 145 mechanical ventilators, 5 high-frequency oscillatory ventilators, 20 units donated bilevel and continuous positive airway pressure machines, 8 donated high-flow nasal cannula systems and 6 transport ventilators. 30 respiratory therapists are part of the COVID team. About 4 to 6 staff are on duty per shift, for 16 days in a month. They are given one small room that serves as their post. Free accommodation and free food is given to them. Since they are part of the COVID team, complete personal protective equipment is provided to them. They are swabbed once a month. The remaining 40 non-COVID team RTs has free food provisions as well. They go on regular number of duty days as mandated by the Civil Service Commission. Davao Regional Medical Center in Tagum City on the other hand has a total of 27 respiratory therapists. They have 49 mechanical ventilators, 3 bilevel and continuous positive airway pressure machines, 2 transport ventilators and 2 high-flow nasal cannula systems. 7 respiratory therapists are part of the ERID team. Everyone goes on a 12-hour shift that would comprise 4 to 6 staff on duty per 12-hour shift. Cotabato Regional Medical Center in Cotabato City is another COVID facility in Mindanao. They have 15 respiratory therapists, 5 of which are part of their COVID team. They have 47 mechanical ventilators, 4 transport ventilators and 2 high-flow nasal cannula systems. Respiratory therapists who are members of COVID team and or ERID team are all crucial part of the intubation team. Since manual bag ventilation is discouraged, the RTs have to be in their full PPE in the patient's bedside before intubation commences. Aerosol boxes are utilized during intubation. Closed suction catheters are also placed in the system to lessen aerosol and droplet generation. As of the moment, the city government of Davao already identified Davao Doctors Hospital to be a temporary treatment and monitoring facility to augment the needs for hospital beds. Private hospitals namely Davao Doctors Hospital, San Pedro Hospital and Davao Medical School Foundation Hospital also formed a rapid intubation team headed by the anesthesia department, the pulmonary unit and the nursing department. Protocols and algorithm were established based on the protocol released by the Philippine Society of Anesthesiologists and Philippine College of Chest Physicians. The team is composed of 2 anesthesiologists and 1 respiratory therapist. This RIT is activated when a patient needs to be intubated from the emergency department to the critical care area. The lockdown and quarantine became stressful to many. For our respiratory therapists to thrive, despite the stress and fear, everyone made a lookout on their fellow RT's mental health. The RT community in the region is a small community. Almost everyone knows each other since majority came from the same institution offering respiratory therapy program in the region. Sharing of inputs, experiences and resources became very evident. Many came to each other's rescue as resources started dwindling due to the imposition of travel bans and lockdowns. A simple message to the very generous donations of machines and ventilators all helped the respiratory therapists in the region survive. Presently, both SPMC and DRMC are almost at its full capacity for COVID cases already. The number of cases is easily tallied since both institutions are already COVID testing facilities. With the leadership of the DO regional director as well as the good communication of the IATF and the LGUs, the impossible feat of fighting COVID-19 became bearable.